is teaching you how to do pre-testing for kids. It's a little bit trickier than adults. So the first thing that you'll want to do is obviously make the child feel comfortable. Here we have Tegan, our lovely assistant. So he's pretty tall, but if you put him on a chair, his body height's not going to be reaching the opening for the optos. So what we're actually going to do is to raise the actual machine up and have him stand. So there's going to be two different things. The first thing we're going to do is have either him stand, or if they're too small, we'll have you move out of the way for just a minute, Tegan. We'll actually get a step stool here and place this under, and we'll have Tegan demonstrate. Even though he's tall, Tegan, I'll have you step up on that first step and face here. Yep, so come all the way up. And so then you would raise it if they were a smaller child, and then raise this up to their height. So those are the two different ways. If you have a really small child, usually the chair won't work. So we'll start with that and then go forward. All right, so the next step that you're going to want to do is explain to the child as well as the parent who's in the room with you exactly what's going to happen and what they can expect. So the first thing you're going to let them know, so Tegan, we're going to take a picture of the back of your eye. There's going to be a bright green flash. You want to keep your eyes open the whole time. When you look through this hole right here, you're going to see a blue bullseye that looks like this. When you press your face up against the mat, it's going to turn this green color, and that's when I'm going to take the picture. And that's when you need to keep your eye really nice and wide. I will be holding on to his chin and the back of his head, and I do let them know that I will be doing that so that there's not any uncomfortable situation going on. Then also explain to the parent the reason why we do this is to have an image, a digital record going forward of the back of the eye to make sure the health of the eye is good and where we need it to be. One last thing before you do take the image is note that if they have any seizures or history of seizures, as the bright light can create an onset for seizures. So as you can see with Tegan here, the hole is a lot lower, so we want to make sure that as he is standing, we'll raise this up so that it's about mouth level. So let's have you just stand straight. And so we want to bring that up here till about that area. So then what you're going to do is come right in front. And so you're going to actually bring their chin to the side. So you kind of tell them to relax. Sometimes, most often, kids will be a little bit stiff. But just turn your chin to the side just to kind of relax, and you'll bring their chin right in there and press it in, and then click the image there to take the picture. So the next one that we're going to do is the OPD machine. This tests how well the patient will see things far away and close up. So again, we have Tegan with as our child. And what we want to do, obviously he's again tall, we're going to be having him stand up, because sometimes too with the chairs they can swivel. So what we want to do here is to make sure that it's an appropriate height, but this marking here on the OPD is the canthus mark. This should line up here with the corner of their eye. So you'll want to make sure that they come forward and tell them to place their chin and forehead, and make sure that their forehead's up there nice and close. Now what you can do is then adjust this, bring the chin down, and then come back behind to bring that. So we can adjust it just a bit more so that it's nice and straight. And sometimes the children will lean backwards. You can also, once you get the actual machine situated, put your hand right back behind so that they don't move, so that the forehead is staying in place. Because if you move it away, you will get off readings. The last thing that's very important with the OPD is that you will get incorrect readings if they are not looking at the top of the hot air balloon. Now, truly, you're not able to see through the screen here if they're staring straight at the top of the hot air balloon. However, if you start to get different measurements, like say a -6 and then a -1/4, +1/4, all different ranges, you know that they're not looking in the right area. So again, you'll want to make sure that the alignment is there, that the forehead is all the way up there, it gets there, the canthus mark is lined up, and then again remind the patients to stare at the top of the hot air balloon, not below or to the side or at the red light shining in there as well. To focus on the top of the hot air balloon to get the correct readings. So the last thing we're going to be doing is the tonometer for eye pressure. So with kids and adults, this is kind of a scary thing for them to do regardless. So what you want to do is first of all put them at ease, let them know that what we're doing is this test for glaucoma, that this top part here will be resting against their forehead, and this part will be coming close to their eyelashes. So I then will kind of somewhat demonstrate and have it close to my eye here, and then let them know. So what you'll do is you'll take your child or your patient, have them stare straight ahead or find a point on the wall, You will then, so stare forward this way. You'll place your hand on their shoulder to steady them as well as yourself and bring this nice and close, and then push the button there. So then that way they're able to, and you'll have them open their eye nice and wide. Open your eye really wide. Perfect. And you're able to get that reading. So have them make sure that this is hitting their pupil and not the colored part of their eyelashes, though they will feel that it will be touching their eyelashes instead of their eye.